Commissioner for Child Welfare at the Office of Children and Family Services. I am bringing apologies from our Acting Commissioner, Suzanne Miles. She's sick today, but she is here with us in spirit. Thank you so much to Albany Med for allowing us to share this wonderful space for this event. It's really important to be here and not anywhere else, because part of the work with mandated reporters is really making sure that we are working closely with the professional groups that really drive families to our attention. So coming here, this is the first time that we've been able to, partner in this meaningful way with healthcare professionals. So thank you so much for this opportunity. I'd also like to say a thank you to our previous commissioner, Sheila J. Poole, who really was a driving force behind the work that we did to update our mandated reporter training. She made it very close to the very end, to the launching of this event, but as many of you know, she's moved on to a national role, but she's here with us also in spirit. So thank you to Commissioner Poole. The work that we're sharing with you today is really centered on making sure that we at the Office of Children and Family Services are transforming the work of child welfare. We know for too long, too many families of color, African American children and Latinx children, and Native American children have not fared well when touched by the child welfare system. And when you look at the outcomes for the children of color who have been in our system for way too long, we have to look at the front door. And when we look at the front door, we're looking at our mandated reporters. So first and foremost for us, the work around the mandated reporter training, we always have to work within the structure of our law. And yes, we have more than 50 professional groups who are designated mandated reporters and are charged with calling our state central register if there is a belief of potential abuse. What we wanted to do with this training is be really intentional to make sure that we are defining what it means to be a mandated reporter, clarifying the law around when you must call the state central register, but also not just grounding the work in the law. Anybody can look up the law. We all have our smartphones. We can Google it and figure that part out. But what we know is last year, over 100,000 calls were made to the state central register. Only 27% of those calls were actually indicated for abuse. And of that percent, we know, again, as I said, many of the families that come to the attention of the child welfare system are African American, Latinx, Native American. And often the impetus for the call was poverty related. Neglect alone. Too many of our cases are indicated for neglect alone. No serious abuse or maltreatment. So how do we, as we think about transformation, redesign, we have to first get to those underlying factors. We have to make sure that the system, which has ballooned into a system where we have more children and families who are coming to us for needs that they could have gotten elsewhere. We know that too many communities have been left behind for too long, and the child welfare system, which is the system of last resort, has over time become a system where families are, unfortunately, as we know, left to navigate lack of resources, lack of supports, and we have a child welfare system that is overrun with families that don't need the intervention of Child Protective Services and foster care, but are in that system, unfortunately. So what does transformation look like? Transformation looks like defining who we are, being intentional about our work, and also saying to those mandated reporters who have picked up the phone because they didn't know where else to call, here's where you call. Our tagline, you don't have to report a family to support a family. We love it, it's pithy. but it's driving a narrative that we want to make sure is across the state of New York. If a family needs help, if you feel that you don't know where there are resources for this family, you should not make a call to the State Central Register. Within our new training, which is online, and we'll be talking about that further, we are intentional to pack it with resources and supports. So we have started a HERES line. Many of you will know Catherine Shelton, our director, launched that HERES line in May of last year. And it's a parent support line which is across the state. And we know that there are a number of support lines across the state of New York. But what we've been able to learn from the HERES line is that there are so many families, and there are also so many community providers who are calling us and saying, I have a family, I don't know what to do. We received a call a few weeks ago from a hospital in Rockland County. A mom had just delivered and she didn't have a car seat. So a hospital is calling us looking for a car seat. Normally that call could have gone to the State Central Register, but we were able to navigate and figure out how to find a resource for that family. So when you think about a system, a state like New York State, and a mom in a hospital just delivering and no car seat, and a hospital saying, what do I do? It tells us, and it tells you all here, the reason and the impetus behind our desire to transform child welfare. You'll hear us talk, and if anyone's heard anybody from OCFS speak recently, we are talking more about upstream prevention. New York State has had a robust system of prevention for a number of years. But what we are trying to do is make sure that those supports...
Is in Alpha 3 neurosurgery.
Wow.
Code blue is in Alpha 3 neurosurgery clinic. Code blue is in Alpha 3 neurosurgery clinic.
Okay, that's important. What we want to make sure is that communities, just like that hospital in Rockland, know where to get services and supports, concrete services and supports for families in their communities. So we are rethinking the way we fund ourselves. We're rethinking the way that we in child welfare use our state funds and the way we use our federal funds as well, pushing more money and support further out into communities. We are partnering with an organization called Care Portal, which will allow communities to, caseworkers and communities right there to identify, just going back to that car seat, identify a resource in your community to access those needs. There's the conversation around the state and the country about abolishing child welfare. And we understand the conversation and what is behind that. But for us, we know that there are a number of families for whom the intervention of Child Protective Services and foster care can save lives. And there are families who don't need this intrusive intervention. So as we, with intention, move to divide out those families that need upstream supports, they can get them. Those car seats are there, readily available and accessible. And those families that need the intervention of Child Protective Services and foster care get that service, get that support, and their lives are better because they've been touched by our system. So it's a lot of work that we cannot do alone. And we did not come to this moment by ourselves. And there are a few people that I want to thank, but most importantly, I want to thank our Governor Kathy Hochul, who has been committed, and you've heard in her State of the State, committed to improving the lives of the children of the state of New York. She is intentional to reduce child poverty, make the lives of the children and families that we all serve much better because of the coordination of our state systems and our work with our community-based providers and our philanthropies across the state. So this work is because of her commitment. Thank you. I'd also like to thank State Senator Jamal Bailey and Assemblyman Andrew Hevesy, both of whom could not be here today, but it was because of their work and dedication that we were able to get the legislation to pass to make the changes to our mandated reporter training. I would also like to thank, and I see her here, Cassandra Kelleher Donnarumma. Cassie, he wave. Cassie used to work at OCFS, and I'm going to say that this training did not push her to OTDA. But this was over a year and a half of hard work, and Cassie's dedication, our push, our pull. I know there were some tough conversations, but the product that Cassie was able to produce before she left us is amazing. And I believe you all of us across the state of New York, you will join me in saying thank you to Cassie for her dedication, for her hard work. But the product that we have created is something that's going to be a landmark, not only for us, but across the country. So thank you, Cassie.
You're welcome.
I would also like to thank our partners, Carrie Sadiq from Schuyler Center and Jen O'Connor for Prevent Child Abuse New York. The design of the mandated reporter training was not just let's sit in a room with a pen and paper, take the previous version and cross out and make some changes. We had a number of focus groups, and I will just list the focus groups. Advisory groups, implicit bias, impacted parents, education, early childhood, healthcare, and social services. These groups met, they talked about the training, they talked about the system, they talked about the flaws, they talked about what we would like to see. Cassie went, we drafted it, shared it again, made some changes, but this was an iterative process. And again, once everybody takes it, you will see what a great product we have created. And I thank you both. I want to thank also our partners at the State Department of Education. The work that we take, so as you all will learn, the mandated reporter training is OCFS is charged with creating the training, but it sits with the State Education Department. The determination as to who has to take it is with the State Education Department. But our partnership over the years with State Ed has transformed, and I would say in part because of the partnership with Kathleen DiCataldo, who's going to come up and speak in a moment. The drivers of families to our system, child welfare, education, community partners, healthcare, law enforcement. Partnering with State Ed has really helped us not only create a different narrative for our educators, understanding also from educators how they feel when they have a family before them and they don't know what to do. And they call the State Central Register because they feel they've exhausted all options before them. We have, during the height of the pandemic, State Ed and OCFS issued joint guidance. We've held WebExes. We've gone to schools. We've had ongoing partnerships and meetings with directors, with BOCES superintendents to really drive home the importance of identifying supports, partnering with your child welfare agency, again, not using the State Central Register as that fall safe, but trying to find a way to support families much sooner. So that has been a challenge, but a great one because we have 52 counties and there are over 700 school districts. You can do the math. But Kathleen has been a great partner in that body of work and has helped transform our system. And it's ongoing work. This is not the end, it's the very beginning. But I want to invite Kathleen up to talk about the partnership and our ongoing work with State Ed.
So, good morning, everybody. This is just a great occasion to really be rethinking how we're training our mandated reporters. I'm Kathleen DiCataldo. I'm an assistant commissioner at the State Education Department. So pleased to be able to be here to give you some comments and thoughts on behalf of our Commissioner Betty Rosa. She wishes she could be here with us today. The Office of Student Support Services, we do lots of things in student support services. So the focus of our team is the Dignity for All Students Act, student-centered supports in schools, student health and wellness, including mental health, expanded learning opportunities, that means after school to all of you that don't know, social emotional learning, school climate safety, school discipline, community schools, alternative education, including our juvenile justice students, and then, of course, foster care. And, you know, I, long ago, worked at the Office of Children and Family Services. And before that, I was an attorney representing children and parents in family matters, in family court. So I have a long history with these issues. I just want to preface my comments with, these are the hardest decisions in the world to make. And, you know, I so value that this training is going to hopefully make it easier for those people on the front line. And I'm going to talk a little bit about our teachers because oftentimes I think teachers in our schools aren't appreciated for the tremendous work that they're doing. But, you know, the New York State Education Department is committed to ensuring that all of our students succeed and thrive in school, no matter who they are, where they live, where they go to school, or where they come from. And in our work at the state level for our schools and districts, we share the mission of the State Office of Children and Family Services and local child protective agencies, as well as the thousands and thousands of mandated reporters, to promote and safeguard the well-being of our state's children, families, and communities. And to be most effective in protecting our students from child abuse and maltreatment, the State Education Department recognizes, participates, and promotes strengthened partnerships, and that has been our work. I can tell you that I called Lisa in May of 2020, in the very beginning of the pandemic, and to talk about our kids that just were not turning on their computers, that were missing by thousands. Fear of what was going on with those kids, fear of, you know, because we were reading about the stressors of lost jobs, increased domestic violence, knowing that our kids were at risk. And that front line wasn't there anymore. And it was only through a video. And, you know, we laughed a couple times this morning saying, oh my goodness, I didn't recognize you because I'm so used to seeing you in a little box, right? And you just don't see people the same way. But that work and trying to understand from those perspectives of Child Protective saying too many calls and teachers and staff saying, but we're so worried, right? Where is the balance? And that is, you know, all the work of child welfare is about that balance. And it's a very hard balance to find, as we know. And hopefully this training will help us find that balance better with less frustration on both sides. You know, and I can't talk about teachers without saying, you know, our educators have demonstrated their dedication to first protecting our students from harm, you know, at the worst of times, sometimes with their own lives. It's pretty scary to go into a school building these days. And one of the first things we ask of our teachers is to create a relationship with the families, right? That kids learn when their families are partners and their parents are involved. So trying to find a balance, again, with that first goal, create a partner in your family, and trying to decide what to do when faced with some of the issues that schools see every day is really, really difficult work. So, you know, and again, every day, every school day, our education professionals are the front line in detecting child maltreatment. In so many cases, they have our kids for 8 hours a day. And their training and expertise and experience to determine whether the facts is what we're calling on every day. A recent report released by Cornell University examined the role of teachers in school in reporting child maltreatment. The report concluded that New York State teachers and other school staff are critical in identifying child abuse and maltreatment. I wanted to share a quote from one of the researchers. More consistent, higher quality training will help teachers do a difficult part of their job with skill and take the steps necessary to protect the children they see every day. Through integrating concepts, adverse childhood experiences, trauma, implicit bias, which are all things that we talk about providing professional learning for our teachers about every day. This will just reinforce, through the new mandated reporter training, the work that we're asking schools to do with their education professionals. Because, again, if we're going to get to the place where all of our children have equity in their school buildings, those have to be the things, those lenses that we're viewing our children through and providing supports through. So the new mandated reported decision tree, tools like that are just fabulous in helping people make the decisions that are so hard to do. And that in the training will strengthen state, regional, and local alignment of education and child welfare systems. You know, Lisa and I have talked so much over the last couple of years, how do you take 52 divided into the 700 odd public school districts? There are hundreds of private school districts, and there's charter schools on top of that. So how do we make that a calculus that works? That actually, so we're creating those partnerships at the local level that will help us support our families. And we've got a couple of good initiatives on the way. I wanted to share a recent poll by the New York State Council of School Superintendents from the fall of 2022 found that 90% of superintendents responded that our schools have taken on a larger role in providing supports for families in our communities, including health, mental health, food, childcare. So schools are stepping up to the plate. They know they have to support their families well, and we just have to keep thinking of ways to support them. The new help, no, what is it?
You don't have to support a family, just support a family.
Yes, to support a family. Making those things easier for schools is really the key, so that the professionals know what to do and when to do it and when to make the difference. So we are encouraging, and Lisa and I were talking about ways that we can get out the information to all of our school professionals about the new training. And we will continue to encourage that work. And then I just want to thank everyone for inviting SCD for being part of this momentous occasion. So thank you.
As Kathleen mentioned, we created a decision tree, which when you log on to the website, the link to the mandated reporter training, you will see the decision tree to help drive the thinking before making a call to the state central register. And as I said earlier, we decided not to start with the law, so you can always look that up, but really took pains to put in the front of the training information around implicit bias, around ACEs, and understanding trauma. And the reason that we did that is we wanted to make sure that as the individuals, again, this is all part of our transformation, as individuals are taking the training, we are helping reframe their thinking about how we all make decisions. We are all touched by implicit bias. We are all impacted in some capacity by ACEs, and our ACEs score impacts how we relate and respond and engage with individuals before us. So as we front-loaded that with just understanding who we are, how we make decisions, we're hoping to drive changes for those individuals as they before they even make a call. I wanted to invite Tim Hathaway up to come and speak as well from Prevent Child Abuse.
Good morning. Thank you very much. I am Tim Hathaway. I'm the Executive Director with Prevent Child Abuse New York. This feels a little bit like a dream come true. We've known for a long time that the best way to prevent child abuse is to build strong families and to support families in a way that really meets them where they're at in the communities. And this tagline, you don't have to report a family to support a family, is kind of that culmination, right? Where we're really recognizing, and I have to applaud OCFS, the governor, all of the systems that are involved here, really taking a new approach, and we're moving towards that transformation. So it's exciting. I am thrilled, especially because we understand that while it is a difficult task to report families, we do know that it is an important element of our system to have mandated reporting in place. And especially in situations where children are in danger, it's imperative that we have trained, trusted individuals available to intervene. However, as we've heard today, in some cases, in many cases, reporting shouldn't always be the first step. This new training, it will help mandated reporters determine what avenues can be explored to assist families. Again, that decision tree helps people think this through. And really looking back to the community. Where are the places, where are the people that can really support families in that community in real time? The here's line, and I just want to touch on that, you've already heard that today, but again, we applaud this move by OCFS. The here's line really is an innovation that helps build out those resources for community level folks. At Prevent Child Abuse New York, we're particularly pleased that the training now includes information on adverse childhood experiences and the impact that ACEs have in the lives of not only children, but the adults that are working for children, both me as a dad and my family, but then also in my role as a professional. ACEs have an impact as well. The inclusion of protective factors that help mitigate the trauma that comes from adverse childhood experiences in this training also is an incredible step forward. An example of a protective factor might be something like a concrete support for a family, where we're saying to that family, you need diapers, you need a car seat, here's where you can locate those resources in the community. That moves us more towards that idea of helping that family move through the crisis that they might be in. We want to thank OCFS and our legislative champions who have been in this work from the beginning, as well as the various advisory councils that were a part of this work, and especially because we had parents with lived experience that were a part of those advisory councils. Folks who have been through this experience of being reported had a chance to comment and say, hey, this is what would really help move this forward. We're proud of that work. Finally, we look forward to the rollout of this transformative training statewide. We think it's a national model. We think that New York is on the cusp of changing so many lives for the future of New York's children. Thank you.
So what can you expect? The requirement, the legislative requirement is that all mandated reporters take this new training by April 2025. As I said earlier, we in New York State, Office of Children and Family Services, are rethinking the way we use our state and federal funds. To be fair, we know that many of the communities from which mandated reporters have been calling the state junction register is because there are no supports in their communities to provide help to families. We know that, as I said, many of the families that come to our attention are for matters that are poverty-related. So we are rethinking our work. We are launching a pilot in March for a direct cash transfer, a guaranteed income pilot, using federal and state dollars to really test out cash as an intervention to eliminate the need for any child welfare intervention. We are, as I also mentioned, using state dollars to support a care portal. So across the state of New York, workers and eventually community-based organizations will be able to log into their care portal and identify, just as the hospital that needed a car seat, either that can be filled by a local community-based provider. If not, there'll be state funds behind that, so you can go and purchase the item. The other way that we are changing our funds, the use of funds in our work is also, we have launched a pilot with a number of mobile response vans, launching in 4 counties, packing the vans with peer supports, peer navigators, DV providers, just basic supplies that individuals need. We have one here, a partnership in Albany and Trinity,
Alliance,
I'm sorry?
Trinity Alliance.
Trinity Alliance, thank you. And these are RVs that are really support units that are going to be, available within communities. So the shift that everyone will start to feel across the state is really child welfare, being intentional in pushing our money and our supports further into the communities so that mandated reporters and supporters, anyone looking to support a family, knows where to go to get that support. At this time, I want to call up Dr. Butterfield from Albany Med to come and speak with us as well.
Thank you so much, Deputy Commissioner. Good morning, everybody. My name is Dr. Rebecca Butterfield. I'm the Chief of the Division of General Pediatrics and Adolescent Medicine at the Bernard and Millie Duker Children's Hospital at Albany Med. I work with children who are victims of maltreatment in our pediatric department, and I'm honored to be part of today's unveiling of this rollout of the new mandated reporter training. We are the region's only children's hospital and an anchor for the Albany Med health system, connecting families to more than 40 pediatric medical specialties. And with the region's only pediatric emergency department, we know firsthand how important this training is. In 2022 alone, our emergency department saw nearly 300 pediatric victims of suspected child maltreatment, including physical and sexual abuse. As a New York State designated SAFE Center of Excellence, SAFE stands for Sexual Assault Forensic Examiner. We have 20 forensic examiners, including nurses, physicians, and advanced practice providers. I'm thrilled today to be joined by Albany Med's SAFE Program Coordinator, Kaylin Dawson, whose efforts really has allowed this program to flourish, and I'm so grateful for her every single day. While the number of abuse victims we treat is really staggering, we know that unfortunately there are children whose abuse continues to go unrecognized. That's why I'm so pleased that OCFS and Albany Med have teamed up today to make this an important announcement about how we can not only better protect the health of children, but also encourage healthier families. As mandated reporters of child abuse and maltreatment, healthcare professionals are often on the front lines and the first to suspect and observe signs of child abuse. As technology has progressed, we're interacting more and more in virtual environments. We saw this increase tremendously during the pandemic with virtual schooling and the rise of telemedicine. Abuse and maltreatment, though, can be very difficult to detect virtually, and that's why it's so important that this new training specifically addresses how to recognize signs of abuse and maltreatment in a virtual setting. We also know that healthy communities and families lead to healthier, safer children. This new training will encourage medical professionals to confront any preconceived notions and implicit biases toward the children and families that we encounter, and to help better understand the impact of adverse childhood experiences on the health of children. I'm especially impressed with the new training's emphasis on helping mandated reporters identify when a family may be better supported by directing them to those culturally responsive community-based programs that the Deputy Commissioner mentioned through the new HERE's Family Line Prevention Program. It will also help us approach our duties, so importantly, with even more empathy and care, the kind that goes far beyond a diagnosis and treatment for both a child and their family. So once again, I'm very delighted to be part of this important announcement and encourage all healthcare professionals and mandated reporters to sign up and complete OCFS's new mandated reporter training as soon as possible. Thank you very much.
Thank you so much, Doctor. We are More than thrilled, and it's not hyperbole to say that New York State is really creating a national model. We have had 2 phone calls with other states about our model. They have taken our curriculum, our decision tree, and asked if they could mock it up. We told them they can't take our tagline, that's ours. But we really are excited about what we're doing, the innovation, the creativity, the thoughtfulness that has gone into this. So most importantly, the partnership. It not just being something centered by OCFS, but really in collaboration across the state with all of the individuals who are touching our families every day. I also want to take a moment before we end to say thank you to our New York State Office of Children and Family Services Parent Advisory Board. We have one of our former members here, Hope Newton. Hope, if you want to wave. We often talk about incorporating the voice of families touched by the system, and it's been sort of a concept and a theory, but New York's, right before the pandemic, OCFS took it seriously. We took the bull by the horn, and we started a parent advisory board, went on pause, and for 3 years we met virtually. Saturday mornings, we met, we talked, we went through a number of different projects that OCFS was launching. But that body of work, starting with an advisory board, has led OCFS to actually hire parents with lived experience to work in our state office. So we are going from just the thought and the space of saying that we are working with families with lived experience to making sure that they are part of the decision-making within child welfare. So when we say we're transforming, we are asking you all to come with us, to watch us, to hold us accountable. But this is really important work and work that we all need to do together. So I thank you all for your time today. And watch this space. More to come from OCFS. We are just excited about the way we are going to continue to improve the lives of the families that we serve. Thank you so much.